I'm making this video just because in pharmacology, under the section of autokines, we have this chapter called as 5-hydroxytryptamine agonist and antagonist, or as the serotonin itself. So in this chapter, they talk about so many serotonin receptors like 5-hydroxytryptamine 1, 2, 3, 4, 5, 6, 7. Okay, so they just give the drug and they say, okay, this drug is working on 5-HT1 by 2/A something they will say. So at that point of time, I get confused, or like most of us get confused. Which receptor is he talking about, and how does it work? So I'm just making sure everything is in one place, so that next time if we again come across such sentences where it mentions receptors, so there are in total about the receptors. If I talk about the serotonin receptors, we have total 7 receptors, and these 7 receptors, the 5-HT1, 2 and 5, it is further divided into subtypes like 5-HT1 A, B, D, E, F. There is no C. Okay, so A, B, D, E, F. And in 5-HT2 we have A, B, C, and in 5-HT3 we have 5A and 5B. Okay, so all these receptors are G coupled receptors except for the 5-HT3 receptor, which is a inotropic or ligand gated receptors. So as you can see, I have mentioned all the functions of the receptors. Like if I talk about 5-HT1A, it regulates the mood, anxiety and temperature. Okay, so the target drugs are like anxiolytic drugs like buspirone. Then we have 1B, it acts as an autoreceptor involved in the vasoconstriction and neurotransmitter modulation. So similarly, 1D, important for the migraine treatment. So next time if you see the textbook of pharmacology where they are talking about this kind of receptors, you can see that they will mention 5-HT1A/B or B/D or 5-HT2A/C, something like that. So it is really confusing for me. They have mentioned in the book like cyproheptadine, so which acts on the 5-HT2A blocker. So it is a 5-HT2 EA blocker, so this is where it is blocking, and if it blocks this receptor, so these functions will be hampered. Okay, then if I talk about another drug, they mentioned like ketanserin, which is acting on the 5-HT2A again on this, so that is the work of ketanserin. Then ondansetron and granisetron, they are acting on the 5-HT3 receptor, so this one, and this is a imposter among all this. This is inotropic receptor, but everything else is G coupled receptor. So if I block this receptor, inotropic receptor mediates nausea and vomiting targeted by antiemetics like ondansetron. So if I block this receptor, there will be less vomiting and nausea, right? Then we have the atypical antipsychotics, which acts on the 5-HT2 blockers. So they are also again talking about the 5-HT2, where the atypical antipsychotics work on these receptors. Then we have methylsergide, which acts on the 5-HT2A and C. Okay, so these two. That is methylsergide. If we talk about ergotamine works on 5-HT2 receptors, ergotamine. And if I talk about the triptans works on the 5-HT1B and D receptors. Okay, so likewise. So that's why this video. So yeah, that's all.